Myofascial pain syndrome. Chronic pain disorder that affects muscles and fascia throughout the body, produces local and referred muscle pain. Trigger points. Tender areas that most commonly develop where fascia comes into contact with the muscle. Referred pain. Describes pain that originates in one area of the body but felt in another. Impingement syndrome. Occurs when inflamed and swollen tendons are caught in the narrow space between the bones within the shoulder joint. Rotator cuff tendinitis. Inflammation of the tendons of the rotator cuff, often named for the cause. Tennis shoulder or pitcher shoulder. Other terms for rotator cuff tendinitis. Ruptured rotator cuff. Develops when rotator cuff tendinitis is left untreated or if the overuse continues. Carpal tunnel syndrome. Occurs when the tendons that pass through the carpal tunnel are chronically overused and become inflamed and swollen. Carpal tunnel. Narrow, bony passage under the carpal ligament that is located on 1/4 of an inch below the inner surface of the wrist. Carpal. Pertaining to the wrist. Paresthesia. Abnormal sensations such as burning, tingling, or numbness. Carpal tunnel release. The surgical enlargement of the carpal tunnel or cutting of the carpal ligament to relieve nerve pressure. Ganglion cyst. Harmless fluid-filled swelling that occurs most commonly on the outer surface of the wrist. Epicondylitis. Inflammation of the tissues surrounding the elbow. Lateral epicondylitis. Characterized by pain on the outer side of the forearm. Tennis elbow. Common name for lateral epicondylitis. Medial epicondylitis. Characterized by pain on the palm side of the forearm. Golfer's elbow. Common term for medial epicondylitis. Hill spur. Calcium deposit in the plantar fascia near its attachment to the calcaneus bone. Plantar fasciitis. Inflammation of the plantar fascia on the sole of the foot. Sprain. Injury to a joint that involves a stretched or torn ligament. Strain. Injury to the body of a muscle or to the attachment of a tendon. Shin splint. Painful condition caused by the muscle tearing away from the tibia. Hamstring injury. A strain or tear on any of the 3 hamstring muscles. Achilles tendinitis. Painful inflammation of the Achilles tendon caused by excessive stress. Spinal cord injury. Occurs when a vertebra is broken and a piece of the broken bone is pressing into the spinal cord. Can also occur if the vertebrae are pushed or pulled out of alignment. Incomplete spinal cord injury. Injury in which a person has some function below the level of the injury, even though that function isn't normal. Complete spinal cord injury. Injury in which there is complete loss of sensation and muscle control below the level of the injury. Paralysis. Loss of sensation or voluntary muscle movements through disease or injury to its nerve supply. Myoparesis. weakness or slight muscular paralysis. Hemiparesis. Slight paralysis or weakness affecting one side of the body. Hemiplegia. Total paralysis affecting only one side of the body. Hemiplegic. Individual affected with hemiplegia. Paraplegia. Paralysis of both legs and the lower part of the body. Paraplegic. Individual affected with paraplegia. Quadriplegia. Paralysis of all four extremities. Quadriplegic. Individual with quadriplegia. Cardioplegia. Paralysis of heart muscle. Cardiac arrest. Common term for cardioplegia. Deep tendon reflexes. Tested with a reflex hammer that is used to strike a tendon. Reflex. Automatic involuntary response to some change either inside or outside the body. Range of motion testing. Diagnostic procedure to evaluate joint mobility and muscle strength. Range of motion exercises. Used to increase strength, flexibility, and mobility. Electromyography. Diagnostic test that measures the electrical activity within muscle fibers in response to nerve stimulation. Electromyogram. Record resulting from a diagnostic test of electrical activity within muscle fibers. Electroneuromyography. Diagnostic procedure for testing and recording neuromuscular activity by the electric stimulation of the nerve trunk that carries fibers to and from the muscle. Nerve conduction studies. Another term for electroneuromyography. Antispasmodic. Medication administered to suppress smooth muscle contractions of the stomach, intestine, or bladder. Anticholinergic. Another term for antispasmodic. Atropine. An antispasmodic that can be administered preoperatively to relax smooth muscles during surgery. Skeletal muscle relaxant. Medicine administered to relax certain muscles and to relieve the stiffness, pain, and discomfort caused by muscle injuries. Neuromuscular blocker. Drug that causes temporary paralysis by blocking the transmission and nerve stimuli to the muscles. Neuromuscular blocking agent. Another term for neuromuscular blocker. Adjunct. In addition to. Ergonomics. Study of the human factors that affect the design and operation of tools and the work environment. Occupational therapy. consists of activities to promote recovery, rehabilitation, and performance of activities of daily living. Activities of daily living. Activities like bathing, grooming, brushing teeth, eating, and dressing. Physical therapy. Treatment to prevent disability or to restore functioning. Myofascial release. Specialized soft tissue manipulation technique. Therapeutic ultrasound. Utilizes high-frequency sound waves to treat muscle injuries by generating heat deep within muscle tissue. RICE. Most common first aid treatment of muscular injuries. Fasciotomy. Surgical incision through the fascia to relieve tension or pressure. Fascioplasty. Surgical repair of fascia. Tenodesis. Surgical suturing of the end of a tendon to a bone. Tenolysis. Release of a tendon from adhesions. Tendolysis. Another term for tenolysis. Tenectomy. Surgical resection of a portion of a tendon or tendon sheath. Tendinectomy. Another term for tendectomy. Resection. Removal of tissue or part or all of an organ by surgery. Tenoplasty. Surgical repair of a tendon. Tendinoplasty. Another term for tenoplasty. Tenorrhapy. Surgical suturing together of the divided ends of a tendon. Tenotomy. Surgical division of a tendon for relief of a deformity caused by the abnormal shortening of a muscle. Tendotomy. Another term for tenotomy. Myectomy. Surgical excision of a portion of a muscle. Excision. Cutting out or removal. Myoplasty. Surgical repair of a muscle. Myopathy. Surgical suturing of a muscle wound. Myotomy. Surgical incision into a muscle. Central nervous system. receives and processes information and regulates all bodily activity, includes the brain and spinal cord. Peripheral nervous system. Transmits nerve signals to and from the central nervous system, includes 12 pairs of cranial nerves and 31 pairs of peripheral spinal nerves. Nerve. One or more bundles of neurons that connect the brain and the spinal cord with other parts of the body. Tract. Bundle or group of nerve fibers located within the brain or spinal cord. Ascending nerve tracts. Carry nerve impulses toward the brain. Descending nerve tracts. Carry nerve impulses away from the brain. Ganglion. Nerve center made up of a cluster of nerve cell bodies outside the central nervous system. Innervation. Supply of nerves to a specific body part. Plexus. Network of intersecting spinal nerves. Receptors. Sites in the sensory organs that receive external stimulation. Stimulus. Anything that excites a nerve and causes an impulse. Impulse. A wave of excitation transmitted through nerve fibers and neurons. Neurons. Basic cells of the nervous system. Brain waves. Patterns of neuron electrical activity. Afferent neurons. Neurons which emerge from sensory organs and the skin to carry impulses toward the brain and spinal cord. Afferent. Toward. Sensory neurons. Another term for afferent neurons. Connecting neurons. Neurons which link sensory and motor neurons. Associative neurons. Another term for connecting neurons. Efferent neurons. Neurons which carry impulses away from the brain and spinal cord toward the muscles and glands. Efferent. Away from. Motor neurons. Another term for efferent neurons. Dendrites. Root-like processes that receive impulses and conduct them to the cell body. Axon. process that extends away from the cell body and conducts impulses away from the nerve cell. Terminal end fibers. Branching fibers at the end of the axon that lead the nervous impulse from the axon to the synapse. Synapse. Space between two neurons or between a neuron and a receptor organ. Neurotransmitters. Chemical substances that make it possible for messages to cross from the synapse of a neuron to the target receptor. Acetylcholine. Neurotransmitter released at some synapses in the spinal cord and at neuromuscular junctions. It influences muscle action. Dopamine. Neurotransmitter released within the brain, believed to be involved in mood and thought disorders and in abnormal movement disorders. Endorphins. Naturally occurring substances that are produced by the brain to help relieve pain. Norepinephrine. Neurotransmitter released at synaptic nerve endings, responds to hypotension and physical stress. Serotonin. Neurotransmitter released in the brain, has roles in sleep, hunger, and pleasure recognition, sometimes linked to mood disorders. Glial cells. Provide support and protection for neurons. Myelin sheath. Protective covering made up of glial cells. White matter. Portion of the nerve fibers that are myelinated. Myelinated. Having a myelin sheath. Gray matter. Portion of the nerve fibers that are unmyelinated. Unmyelinated. Lacking a myelin sheath. Meninges. System of membranes that enclose the brain and spinal cord of the central nervous system. Dura-mater. Thick, tough, outermost membrane of the meninges. Dura. Hard. Matter. Mother. Epidural space. Inner surface of the vertebral column. Subdural space. Located between the dura-mater and the arachnoid membrane in the skull and vertebral column. Arachnoid membrane. Second layer of the meninges located between the dura-mater and the p-mater, resembles a spider web. Arachnoid. Having to do with spiders. Subarachnoid space. Located below the arachnoid membrane and above the p-mater, contains cerebrospinal fluid. P-mater. Third layer of the meninges, located nearest to the brain and spinal cord. Pia. Tender or delicate. Cerebrospinal fluid. Clear, colorless, and watery fluid that flows throughout the brain and around the spinal cord. Spinal fluid. Common term for cerebrospinal fluid. Cerebrum. Largest and uppermost portion of the brain. Cerebral. Pertaining to the cerebrum or to the brain. Cerebral cortex. Outer layer of the cerebrum, which is made up of gray matter and is arranged in deep folds known as fissures. Fissure. Normally occurring deep groove. Cerebral hemispheres. Two divisions of the cerebrum that are connected at the lower midpoint. Corpus callosum. Connects the left and right cerebral hemispheres. Left cerebral hemisphere. Controls the majority of functions on the right side of the body. Right cerebral hemisphere. Controls most functions on the left side of the body. Cerebral lobes. Paired subdivisions of the cerebral hemisphere. Frontal lobe. Controls skilled motor functions, memory, and behavior. Parietal lobe. Receives and interprets nerve impulses from sensory receptors in the tongue, skin, and muscles. Occipital lobe. Controls eyesight. Temporal lobe. Controls the senses of hearing and smell and the ability to create, store, and access new information. Thalamus. Produces sensations by relaying impulses to and from the cerebrum and the sense organs located below the cerebrum. Hypothalamus. Performs 7 regulatory functions located below the thalamus. Cerebellum. Second largest part of the brain located at the back of the head below the posterior portion of the cerebrum. Brainstem. Stalk-like portion of the brain that connects the cerebral hemispheres with the spinal cord. Midbrain and pons. Provide conduction pathways to and from the higher and lower centers in the brain. Also control reflexes from movements of the eyes and head in response to visual and auditory stimuli. Medulla. Controls basic survival functions. Spinal cord. Long, fragile tube-like structure that begins at the end of the brainstem and continues down almost to the bottom of the spinal column. Peripheral. Pertaining to body parts that are away from the center of the body. Autonomic nerve fibers. Carry instructions to the organs and glands and from the autonomic nervous system. Sensory nerve fibers. Receive external stimuli and transmit this information to the brain to be interpreted. Somatic nerve fibers. Convey information that controls the body's voluntary muscular movements. Motor nerve fibers. Another term for somatic nerve fibers. Cranial nerves. 12 pairs of nerves originating from the undersurface of the brain. Peripheral spinal nerves. 31 pairs of nerves grouped together and named based on the region of the body they innervate. Autonomic nervous system. Controls the involuntary actions of the body. Homeostasis. Process of maintaining the constant internal environment of the body. Sympathetic nervous system. Prepares the body for emergencies and stress. Parasympathetic nervous system. Returns the body to normal after a response to stress and maintains normal body functions during ordinary circumstances. Anesthesiologist. Physician who specialized in administering anesthetic agents before and during surgery. Anesthetist. Medical professional who specializes in administering anesthesia but is not a physician. Neurologist. Physician who specializes in diagnosing and treating diseases and disorders of the nervous system. Neurosurgeon. Physician who specializes in surgery of the nervous system. Psychiatrist. Physician who specializes in diagnosing and treating chemical dependencies, emotional problems, and mental illness. Psychologist. Specialist who evaluates and treats emotional problems and mental illness, holds an advanced degree but is not a medical doctor. Cephalalgia. Pain in the head. Headache. Common term for cephalalgia. Migraine headache. Characterized by throbbing pain on one side of the head, can be preceded by a warning aura. Warning aura. Sensation perceived by the patient that precedes a migraine. Cluster headaches. Intensely painful headaches that affect one side of the head and may be associated with tearing of the eyes and nasal congestion. Encephalocele. Congenital herniation of brain tissue through a gap in the skull. Congenital. Present at birth. In the doctor's office, the patient's blood oxygen saturation is measured with pulse oximeter. Which of the following is a source of vitamin C? Citrus fruits. Principles of professional ethics may include all of the following except financial control. Which a medical assistant scheduled to remove stitches from a patient's arm noticed that the area WA is red, swollen, and painful upon the slightest touch. The patient requested to see the physician and was reluctant to let the medical assistant remove the sutures. The attribute important in dealing with this situation is flexibility. Which of the following terms means incision in the muscle? Myotomy. Which of the following is a written description of work experiences, skills, and educational background? Resume. What is the term for the visual examination of the vagina and cervix? Colposcopy. Which of the following would be an example of personal accountability? Admitting to an error made. Two rescuers are performing CPR on a 9-year-old child who collapsed and is not breathing. Which of the following actions should the rescuers take? Attach the AED and follow the voice prompts. The RMA certification is maintained by earning 45 CEUs within 3 years or 15 CEUs per year. Which of the following identifies the components that are central to Sigmund Freud's theories of personality? ID, ego, superego. Which of the following pulses is auscultated with a stethoscope? Apical. Demographic information to be included in the patient's record includes name, address, and telephone number. Which of the following questions is considered legal when conducting a job interview of a prospective employee? Are you authorized to work in the United States? How often should quality control be performed for laboratory procedures? Daily. In a normal blood cell differential, what is the total number of cells counted? 100.